Well, thank you, Lauren. It's the day after Valentine's Day, and a lot of people receive chocolate and other candy.
Joining us now is professor at Northwestern University Medical School and WGN Morning News medical contributor, Dr. Lauren Streicher.
I don't know. Are we talking about candy? I guess that's why we let him with that in a minute.
We are absolutely talking about candy.
So, let's talk about that first, right?
No,
or what do you want to talk about? Something
first, we
else
want to talk about something that just came across the news this morning that we saw about autism and a medicine that might help.
Right, there was a big headline that there's a medication that might help cure autism. And basically what this is lamotrigine, which has been around for a long time. It's used to prevent seizures, it's used to help bipolar conditions and anxiety. And what they found is that maybe lamotrigine might alter some of the neurologic changes that are associated with autism. But here's the caveat. It was a little premature for this headline from my reading because this was just in the laboratory. They were testing it on rodent neurons and human neurons, which is really interesting and could lead to something, but from my understanding, it's not like they've had actual real-life human trials yet.
Okay, let's talk about those health benefits.
Let's get
of
into chocolate.
Yeah.
I mean, because if you polished off that box of chocolate you got yesterday, it is good to know that, yes, there are established health benefits to chocolate, really specifically cocoa, as opposed to the sugar and the fat and all the other stuff. But we know that cocoa is absolutely associated with a decrease in blood pressure, a decrease in cholesterol. It might help decrease diabetes. And the big one is that in a study, which was pretty recent, a large study, that giving cocoa extract to a large number of people, they had a 27% decrease in cardiac death. All right, but it's the cocoa. And it's specifically in dark chocolate, by the way, has a lot more cocoa than milk chocolate. So there are even doctors and health advocates that say, you know, a little square of dark chocolate every day might be good for you. Unfortunately, I like milk chocolate and the nuts and hot fudge and all that. Not good for you.
A new pill for constipation.
This is genius. Have you heard about this?
No.
Oh my God, this is a pill. It was actually FDA cleared in the summer. It just became available this week. And this is a pill that you swallow and it vibrates its way down your gastrointestinal tract and kicks your gastrointestinal tract into action to help you poop.
Wow.
So the way that this works is when you take the pill, you basically put it in a little pod at night and it activates a microchip. And then you swallow the pill and it takes 14 hours to work its way down your intestine, vibrating on and off as it goes, and it gets your system to kick in. You don't feel the vibration. There's no other benefits. I mean, it's just vibrates its way down. You poop it down. You poop it out at the end of it. But in the clinical trials, they found that people who took this pill were almost twice as likely to poop as the ones that took the fake pill. But this is important. This is not meant for the occasional constipation. You know, you're on a trip or you ate your box of chocolates. Right. This is meant for people who have chronic constipation, which means less than 3 bowel movements a week, and it's a miserable condition. So this is kind of interesting.
All right.
You need a prescription.
How about married people versus single people and heart attacks?
Well, this in and of itself is not new. I mean, there's been a lot of studies that look at the impact of being married and heart disease and the likelihood to survive. But what is new is a study just came out that was really big. It had 20,000 people in it. And it looked at the timing, meaning they looked at people that were hospitalized with a cardiac event, and they compared people that were married with people that were not married, and they found that in the hospital, they did just as well. The survival rates were the same. It was when they followed them 2 years later that they found that the single people did not fare as well. They were much more likely to be re-hospitalized with a heart attack or a stroke. So they're not really sure why this is. I mean, the fact that they all did well in the hospital is basically telling you that their heart function was the same. It's what happens after. And they think that people who are in relationships and are married are more likely to have someone who's like pushing them into good heart health behavior and good decision making. So bottom line is eat the chocolate, take your pooping pill, and have a nice relationship, and here's your health, right?
All right, check out Dr. Streicher on social media. Thanks for being here.
Thank you, Doctor. Time now for Around Town.
Hey, Anna.
They are known for their wagons, but Radio Flyer now